Hello, my name is Alicia Smith, and this is my Media Project 1 for Anatomy and Physiology 142 Lab with Professor Donald Pump. So, what is the study of anatomy and physiology? The study of anatomy and physiology gives humans the foundation to understanding the body and its many different functions and parts. So anatomy translates to the process of cutting up, and it's the science of the body's structures and their relationships together. Anatomy was first studied through the process of dissection, and it still is studied through dissection in many cases. Physiology translates to the study of nature, and it's the science of the body's functions and how the body parts work together. So homeostasis is a very important concept to consider when we are studying anatomy and physiology, because homeostasis is the body's way of maintaining relatively stable conditions within the body's internal environment. Homeostasis occurs because of the body's many different regulatory systems all working together cohesively. So to look at the case study that I'll be discussing today, we have a patient named Anna. She's a 22-year-old Caucasian female. She's 5'4" and she's 120 pounds. So Anna decided to make an appointment with her primary care physician due to noticing cervical lymphadenopathy that started approximately 1 month ago. So when I say cervical lymphadenopathy, this means that she has swelling in a lymph node that is in her neck region. So Anna also has noticed that she's having severe night sweats, where she is soaking through her clothes and waking up several times a week to this, which is very abnormal for her, especially living in a colder climate. She also is having cachexia, which is unexplained weight loss, where she is not trying to lose any weight. It just seems to be shedding off of her. And then pruritus, which is itchy skin, and she's noticing that in the last several months, her legs have been very itchy, especially at night, as well as the skin by her armpits. The last symptom she has is an off and on fever, and this started up more recently, and this was one of her more concerning symptoms and a big reason why she made an appointment with her doctor. So Anna has experienced swelling in her lymph nodes prior to this when she was sick with, say, the flu or even just a common cold. However, the lymph node she's concerned about now is much larger than a normal lymph node, and it seems to be growing more rapidly within the last month and not shrinking back down. And then the other concerning symptom is that the lymph node is in a fixed position. So it is staying in place when it's touched. It doesn't seem to wiggle around, and it doesn't seem painful to the touch at all, which you may think is a good thing, but lymph nodes actually should be more tender when they are having a reaction to a virus and they're trying to fight off the virus. Whereas this, especially with the fact that she doesn't have a virus or she doesn't think she has a virus, makes it more concerning that it's not painful to the touch. So Anna's doctor is instantly concerned with these symptoms, along with the touch and feel of the lymph node, the lymphadenopathy. So we went ahead and Anna went and scheduled an ultrasound and eventually a biopsy after the ultrasound. And the doctor also recommended she do chest radiographs and then a CT and a PET or a PET scan. And basically what they're looking for when they're doing these imaging and biopsy is malignancy. So the results of Anna's scans and biopsy unfortunately did show evidence of Hodgkin's lymphoma. So Hodgkin's lymphoma is a type of blood cancer that affects the lymphatic system, and the cancer starts in the lymphocytes or the white blood cells. So to talk about the lymphatic system a bit, the lymphatic system consists of lymph plasma, lymphatic vessels that transport the lymph plasma, and then organs and structures that contain lymphoid tissue, as well as red bone marrow. The lymphatic system aids in homeostasis, as I spoke about before, by draining interstitial fluid to the cardiovascular system and then helping the body with disease defense, which is a very important aspect of the lymphatic system. So the lymphatic system consists of two main types of white blood cells, or lymphocytes, the B lymphocytes, or B cells, and then T lymphocytes, or T cells. So the B cells are the ones that create proteins known as antibodies that help fight off disease, and Hodgkin's lymphoma actually usually starts in the B cells. So here's an image of a lymph node in the first picture here, showing different portions of the lymph node, and then we have the lymphatic system in the next image, which I will get more deeply into in the next slide. And within the lymphatic system we have the spleen as well. So lymph nodes are scattered throughout the body, with large groups present near the axillae, the groin, and the mammary glands. So the lymphatic system consists of lymph nodes, tissue, the spleen, the thymus, and the tonsils. So the lymph nodes and tissue helps to protect the body by removing any harmful materials like bacteria and tumor cells. The spleen filters out bacteria and viruses that are found in the blood, and it also stores blood and removes any damaged red blood cells. The thymus is what creates and trains the T cells, which are the T lymphocytes that help the immune system to fight infection and disease. However, most of the T cells are actually created prior to birth. And then the tonsils are kind of the body's first line of defense. They're found in the back of the throat, and they help to filter out debris that is entering through the mouth and the nose, to help to try to prevent the rest of the body from getting infected through anything that might be in the air. So how does Hodgkin's lymphoma affect the lymphatic system? So Hodgkin's lymphoma causes the B lymphocytes to multiply in an abnormal way, and eventually this will begin to start collecting within the lymph node, hence the swelling and fixed position of Anna's lymph node, because there's several cells that are now building up and creating a tumor. These abnormal lymphocytes will also begin to lose their ability to fight off infections, so Anna will become more susceptible to infection, which may be why she's experiencing signs of illness and fever. So how does Hodgkin's lymphoma affect the rest of the body? So we're looking at the image I have found. It's a chest radiograph, and it's showing that we have some left mediastinal enlargement. So this kind of grayish area is abnormal, and the doctors are highly concerned about that. They've also found in the ultrasounds that we have several enlarged lymph nodes, and the CT scan of the chest and abdomen reveal even more enlarged lymph nodes in the mediastinum and the cervical or neck area. And then the PET scan, which will go ahead and inject Anna with a certain type of dye that can actually highlight if Anna has any lesions, cancerous lesions on her bones. So in this case, it did highlight that she does have a few lesions on her bones. So with all of these different ways of looking at the body, we can see that Anna has stage 4 Hodgkin's lymphoma, which has begun to metastasize into her lungs. So in this case, it's a more severe and aggressive form of the cancer. So to metastasize means that the cancer cells in Anna's body started in her lymph nodes, but over time they have begun to travel to different parts of her body through her blood and lymphatic system. And in this case, they've traveled into her lungs, and they've even made it to her bones. So a cancerous tumor was found in Anna's lungs. In this image I have here, just to give you a better idea, we have the starting point of the cancer and how you can kind of visualize how it would travel through the blood vessels into a different organ and start to metastasize or develop a tumor in a different location. It looks like, in this case, it looks like the liver, but in Anna's case, it would be the lungs. So, moving from the lungs into talking about the respiratory system. The respiratory system is made up of the nose, the throat or the pharynx, the voice box or the larynx, and then the windpipe or trachea. And then finally the bronchi, which are the tubes that carry oxygen to and from the lungs. And then the purpose of the respiratory system is to move fresh oxygen into the body on the inhale, and then remove waste gases like carbon dioxide from the body when you exhale. And then once oxygen reaches the lungs, it then can move into your bloodstream, and it's carried through the red blood cells to go throughout the rest of your body and all of your other organ systems. So I have an image of all the different parts that make up the respiratory system. And then down here, you can see that I've found an image of a chest radiograph where it looks like the left mid area of the lungs has potentially a tumor that is pointed to in that red arrow. So Hodgkin's lymphoma causes tumor cells to grow in the body. And in this case, we have a tumor that has begun to grow in Anna's lungs. And what that can do is it can actually grow large enough to begin pressing on Anna's airway, and that will start to restrict air from entering the lungs, making it much more difficult for her to breathe. She might develop a cough or a hoarse voice or shortness of breath. And then a tumor in the lungs may also cause fluid to build up due to something called pleural effusion. So what pleural effusion is it is when the cancer cells invade the space between the lungs and the chest wall, which is called the pleural space. And this causes fluid to build up around the lungs. So therefore the lungs can't expand to their fullest potential, and oxygen intake is therefore restricted. So to touch on the cardiovascular system and how it can relate to what we're discussing today, the cardiovascular system includes blood vessels, and the heart. And the general purpose of the cardiovascular system is to circulate blood throughout the whole body. So blood transports oxygen and nutrients to cells and the organs in the body, and it's very crucial for aiding the body to meet the demands of pretty much any strenuous or physical activity at all, as well as any stressful situations that might cause heart rate to rise, respiratory rate to rise, which will require more blood to be pumped throughout the body. So I have an image of the oxygen transport cycle. As you can see how the oxygen sits on the red blood cell and moves around the body. And then up here I have an image of the heart and the different portions of the heart. And what the heart is it's the organ that pumps blood and oxygen throughout the body, and it delivers waste products like carbon dioxide back into the lungs that can then be removed through exhaling. So how does the cardiovascular system relate to Hodgkin's lymphoma? So the lymphatic system relates to the cardiovascular system in that they both exist to collect excess interstitial tissue fluid and return it back to the cardiovascular system. So in some cases, treatment for Hodgkin's lymphoma, which would be radiation and chemotherapy, which I'll get into in a later slide, may actually cause something called CTRCD, which stands for Cancer Treatment-Related Cardiac Dysfunction, which can cause decreased ability to the left ventricle to pump blood effectively, and this can actually lead to more serious conditions like heart failure, because the heart isn't able to pump in the way it needs to support the body. Another thing that can happen with Hodgkin's lymphoma is tumors are growing caused by the lymphoma, and they may begin to metastasize into the pericardium or the myocardium during the course of the disease, and this would be called secondary cardiac lymphoma. However, luckily this has not begun to happen to Anna. Sorry, skipped a slide. Okay, so the endocrine and nervous systems. To begin, the endocrine system consists of the hypothalamus and then several different glands that produce hormones. So we have the pineal gland up at the top here, as you can see in this diagram. We have the thyroid gland, we have parathyroid gland, the thymus, the adrenal glands, and then the pancreas, which are all part of the endocrine system. And then finally, depending on if you're male or female, we have testes in the males and ovaries in the females. So the endocrine system is responsible for hormone production via the many different glands and organs that are released into the body, and then these hormones will travel to tissues and organs throughout the body. And these hormones control growth and development of the body. They control a body's metabolism and the ability to reproduce. And then moving into the nervous system. So we have an image right here that kind of shows what the nervous system encompasses. The nervous system consists of the brain and the spinal cord, and then the nerve endings that branch off throughout the entire body. So in the pink, we have the brain and spinal cord, and that's making up the CNS, which is the central nervous system. And then the peripheral nervous system is the other branches of nerves throughout the whole body. So what the nervous system does is it transmits signals between the brain and the rest of the body and its organs. And it's responsible for controlling the thoughts and feelings of a person. And it allows us to do things like speak, walk, swallow, and breathe. And then it also controls all of our reactions to emergency or stressful situations. And you can relate this to the endocrine system because the endocrine system is responsible for creating hormones. And when these hormones are released, we will have a reaction to these hormones via the nervous system. So how can we relate these two systems to Hodgkin's lymphoma? So the endocrine system and the lymphatic system both contribute to the protection of the immune system. So the thymus gland, which is found in the endocrine system, is essential in both of the body systems, and the body's T cells come from the thymus gland's hormone production. It is possible for the endocrine system to be affected by the treatment of Hodgkin's lymphoma. So issues like fertility and low thyroid hormones may actually start to present after enduring years of chemotherapy. And then the central nervous system, or the CNS, can relate to the lymphatic system because it plays a large part in the body's immune system. The CNS regulates inflammation and responses against pathogens via the hormones that signal the brain. And it's pretty rare, but it's possible for Hodgkin's lymphoma to metastasize into the brain or the spinal cord. And this would cause effects on the central nervous system, and you may start to see neurological disorders start to present due to a tumor that is pressing on the brain or the spinal cord and causing damage to the nerves. So how would we go about treating Hodgkin's lymphoma for poor Anna that's been diagnosed? So she had the biopsy, and with that biopsy, they did something called an excisional biopsy, where they not only take a small portion for biopsy, but they just go ahead and remove the whole lymph node. However, typically for Hodgkin's lymphoma, surgery isn't a very common way you would treat it. We usually go through two different things. The first one being chemotherapy, which is a drug treatment that will use chemicals to kill the fast-growing cancer cells in the body. So as you can see in this top image, the chemotherapy is administered through an IV bag that goes intravenously into the patient over several different courses. And it will go into the bloodstream at a controlled rate and disperse into the rest of the body and kill the cancerous cells that are living in the body. And then radiation therapy is the use of high doses of radiation to damage the DNA of cancer cells, and therefore it will slow or completely stop the growth of the cancer. So Anna was actually recommended to undergo both of these due to her stage 4 Hodgkin's lymphoma. So you can see here down at the bottom what it might look like to go through radiation treatment. It looks like they're using a CT image to go ahead and find the tumor and then localize down with the radiation. So curing stage 4 Hodgkin's lymphoma, it is possible to cure this disease. She was diagnosed stage 4 due to the fact that it has metastasized into her lungs, and her oncologist, or the doctor that is specialized in cancer treatment, is recommending that Anna goes ahead and completes 6 or even more than 6 cycles of a chemotherapy regimen called ABVD, and that will include a combination of 4 different drugs that have been tested and proven to kill cancerous cells. And then afterwards, if the chemotherapy works in 6 sessions, it will be recommended for Anna to follow up with some radiation therapy, which will go ahead and target the initial site of the production of cancer, so her lymph node. The 5-year survival rate for someone diagnosed with stage 4 Hodgkin's lymphoma is around 65%, so it's not the worst odds. Stage 4 is definitely more serious than stage 1 through 3 of Hodgkin's lymphoma. However, with proper treatment, she can be completely cured of this cancer. She will need to follow up with her oncologist likely every 6 months or less for the first few years at least, or maybe for the duration of her life, to ensure that the Hodgkin's lymphoma has not regressed back, and she can consider herself cancer-free. So that's the end of my presentation. I've put some works cited at the end of all the websites that I used to do my research for this project today. Thank you so much for listening. Hope you have a great rest of the semester and a good rest of your summer.